And then we find the targets that are the Achilles' heel, if you will. You know the story of Achilles? So Achilles' heels were the only portions which was fallible. The rest of him was invincible. So the diseases also have these weak spots. So for drug discovery people or for basic researchers, we try to find the targets where we need to hit so that the disease dies. And then there are these downstream processes, clinical research and clinical care that is actually the health care that is given to the patient. And of course, a big part of it is awareness or education. A lot of the patients, and I'm sure I have many in the audience, I know I am one, when I'm the patient, the doctors are very reluctant to describe to me, to explain to me what it is that is exactly ailing me. And he also refuses to tell me what treatment I'm getting. So he is legally bound by law to tell me that. And part of the education is for, and this meeting also aims to do that, is to bring to the masses what options that there are. Either that is in practice or sometimes in very, very critical cases, ongoing research can also be applied to the patients. So this, in a nutshell, basically the bioinformatics and the medical informatics part talks about stringing this whole study together. And then there is this part which talks about the nitty-gritties of drug discovery that again Dr. Singh very nicely elucidated. There's a lot of research, 90% of it you have to throw away. Some of it can be listed, screened if you will, by in silico trials, which is a virtual sort of a probability of success of your drug hitting the target. And there's the IPO and lots of legal issues and ethical issues and licenses and what you may. And ultimately you have something which is a viable process or a product or a technology or an instrument that comes to you. So this is the guy, and we would like to give him this through understanding of these. Can you see the cursor? I can't really handle this. Is it okay? All right. So in translational biology, my laboratory works on various we are basic biologists, so before taking it to the humans, we would like to understand the living body, which is very similar to human beings. However, when I say similar, there are limitations, there are similarities, and there are dissimilarities. So a lot of preclinical molecules ultimately do not end up in the clinic. Although they completely make your mouse or your guinea pig fine, but when you try to translate it into humans, it doesn't work. So the disease areas that we work on is acute and chronic allergic asthma, idiopathic pulmonary fibrosis, lymphopoiesis and lymphoid homing, so where the lymphocytes are made and where they go and how they go. Cellular trafficking is a big part of what we do. Septic and aseptic peritonitis, inflammatory bowel disease. Translational outcomes research, we use 5-pronged approach. We use novel format antibodies, the one that I showed you with the camels. We also use chicken antibodies, microdynamics of functional food, including phytochemicals. You'll see 2 of the posters that are on display. One is on khejur and one is on pan. We use other traditional medicines also and try to look for useful compounds in them, or the whole thing as a functional food. Novel combinatorial probiotics, that also the clip that you saw. Stem cell differentiation by tissue engineering and stem cell niche. Very beautiful lectures given by Dr. Deepa Bhartia, where she talked about tissue engineering into the pancreas and liver, I think. Liver and pancreas, I think. We work on lung and kidney. And in the end, nano drugs and nano vehicles, chemists, polymer scientists, bioengineers work with us in developing scaffolds and developing vehicles that are coupled with our drugs, our cells, for efficient delivery to the target. One anecdote let me share with you. Yesterday, when I was talking to the press, who was going to cover this meeting, one of my young reporters said that, "Madam, I cannot come because I'm not well." And then I said, "What happened?" And then he's saying, "আমি কি করে আপনাকে বোঝাবো, মানে ভদ্র ভাষায় বলতে পারবো না আমি." So then I said, "কি হয়েছে?" He's having irritable bowel syndrome and he's bleeding from his anus, and of course the relation with him with me is very, very formal, and he cannot describe it to me, and he's saying in very, very vague, very, very euphemistic terms, but he's bleeding from his anus, and when he feels like he needs to go to the toilet, and he's afraid that he may bleed, he may start bleeding again, and he's saying, "Madam, I have not eaten anything for the last 2 days." So we have this guy who is addicted to smoking and he has tremors. He has a very high pressure job because he's a journalist, and then he's having these other things. Now, what sets an inflammatory bowel syndrome on is one of the study areas that we do. And while doing that, we are in touch with a lot of clinicians we do trials with. We are also in touch with microbiologists that we get the combinatorial probiotics from. And you see somebody like this, and he doesn't have healthcare insurance. So he's saying, "Madam, আমি যদি এখন টেস্ট করাতে যাই, পাইলস আর গ্যাস্ট্রাইটিসটা খালি আমার নিউজপেপার সাপোর্ট করে। যদি আমার পাইলস আর গ্যাস্ট্রাইটিস না হয়, তাহলে আমার যে ডায়াগনস্টিক টেস্টগুলো করতে হবে, বা 30